Good evening, everyone. Thanks so much for having me here. To me, Judge Mack is not Laura, she's Judge Mack always. So we've done so many great projects, innovative projects together. So again, I'm Carol Zuniga. I'm the Chief Executive Officer at Hegira Health. And we are a comprehensive behavioral health care organization serving all of Wayne County, and we have contracts with Oakland, Washington, and Lenawee and Monroe as well. For our substance use services. So we're comprehensive, infants through older adults. Our substance use services include withdrawal management, short-term residential through Oakdale Recovery Center in Canton, intensive outpatient services. Chris Odrowski, who's over there taking a picture, is our guy who's running around making sure the whole world knows about substance use services and substance use disorders. But we're out there trying to do everything that we can to educate the community about substance use disorders. So a little bit about myself. So I'm a limited licensed psychologist in the state of Michigan. I've been with Hegira about 30 years. I started out as a counselor, therapist in community mental health, and my supervisor at the time said, I got an opening in the substance use department. I need you to go over there. So I'm like, well, okay. I didn't know anything. And so I went over there, and this was back in 1987. I was 2, right? So I was a prodigy. But it was a time when there was no integration of mental health and substance use services. They were completely separate. If you mentioned that someone with a substance use problem had a mental health issue as well, you were shunned. I was shunned. I was the newbie in the clinic who was bringing new ideas in, who refused to allow people who appeared to have serious anxiety disorders, who appeared to have other mental health conditions, who appeared extremely depressed, to not have co-occurring psychiatric services at the same time. I came over to Hegira Health, previously Hegira Programs, in 1993. I was 7 by that time. And I came in as a clinical director, and we were a much smaller organization. And one of my responsibilities was Oakdale Recovery Center. And I can tell you some of the early experiences I had at Oakdale that I'm so happy to say that we're so far beyond. But I can remember being over there one evening and it being very cold in the building. And one of the recovery techs, who are aides working in the building, it was very, very cold. And I'm like, well, we need to get people blankets because there's something wrong with the heating system. And he turned to me and he said, no, they need to reach bottom. They need to suffer. They need to know what it's like to be really cold. And I said, no, they need to know what it's like to be really safe and comfortable so that they can engage in treatment. And I was shunned by my own staff. I brought in a psychiatrist at Oakdale Recovery Center in 1995, which was a big, big taboo. Ford Motor Company wouldn't refer to us any longer because I was integrating psychiatry and substance use services. And I had staff who left, who said that if we were going to be prescribing medication to people with substance use disorders, that I was violating their licenses, and they left. So little did they know that I really didn't know what I was talking about back then, but I had a notion. And what have we learned since is that there are so many people that are using substances who have co-occurring mental health disorders, and if we're not treating both, we're going to be challenged to help that person maximize their functioning. And this is a message that we really, really need to get out and across. It's lived right now, but unfortunately, both mental health and substance use still are suppressed by stigma. It's not that helpful to have a mental health condition over a substance use condition in terms of public attitude and perception. I was appalled by your description of the physician who was nasty in not wanting to address your son's medical condition because he was a substance user, as if being a substance user makes you a bad person. I was talking with Mr. Judge Mack a few minutes ago, and the culture that we are still battling. That goes back to when I was a kid, and just say no to drugs, right? As if just saying no was enough, right? So people still, even parents, still have that in their heads until you get close to it and you understand. We know that this is a brain disorder. We know that substance use is a mental disorder. It affects brain functioning, it affects behavior, it affects judgment, it affects ability to use what you've learned in the past to make future decisions, to maximize your life. We know that. So we need to get other people, we know that, right? In this room, we know that. But how do you get the rest of the world to buy into it? That someone's brain using drugs is not like fried eggs in a frying pan, if you're old enough to remember that campaign, right? So, I mean, it's so disgraceful. It's an insult, it's derogatory, and it all needs to be pushed as far away as we can. One of the campaigns that I'm working on, so I'm the vice chair of the Detroit Wayne Association of Addiction Professionals, and one of my campaigns right now is to address for public substance use services equality in funding. So when you look at what is available in funding for persons who are not insured, and you look at it just in comparison to public mental health dollars. So my soapbox is that we as a provider get reimbursed 50% for the same services, the same service provider for substance use services that we get paid for mental health services. Now my CFO says don't say that too loud because you don't want them to reduce the mental health reimbursement, right? But it's a shame. And what does it say? And I'm expressing this to legislators. I'm saying you are discriminating. You are openly discriminating against people with substance use disorders by saying you are not worth full funding. You are only worth this much. And I was also telling Mr. Judge Mack about an experience I had in a conference that I was in, and with a Harvard professor who is, a world-renowned expert in substance use, and he's, full force on anti-stigma. We don't use the words abuse. We don't use the words addiction. We don't use words that are negative in people's minds. We need to move away from anything that has connotation other than disease with substance use disorders. Substance use disorders are just that. They're medical conditions. But he's showing slides, and he's talking about the different fields. And he shows a slide of multiple different types of buildings, right? And he asked the crowd to identify which are mental health facilities and which are substance use facilities. And everybody knew. And he just kept going. And I'm like, wait a minute. This is awful. How did we all know? We all know because there's no money that's put into people with substance use disorders. So how are we to provide comprehensive services? How are we to follow people, give them the support, coordinate the services that we're expected to do if we don't get paid for it? So anyhow, I actually had a prepared thing that I was going to do that I didn't do because the passion of your son and Jan, of your children, I couldn't read my thing that I said, that I was going to say, because y'all know it already. Y'all know that stigma is discouraging, that stigma is damaging, that stigma is both internal and external. It's our biggest enemy, and that we need to fight it in order to continue to provide good care for the people that we care about. My heart goes out to all of you who have had tragedies in your lives. My encouragement to all of those who are in recovery, struggling with recovery, doing whatever it is that you need to do to find support. I hope you find it. Reach out. There are a lot of good people out there who want to help, and I wish you all well. Thank you.